Hi everybody. In the last several videos we've been talking about Dr. Bredesen's ReCODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidenced in successful studies in 2014, 2018, 2022, and current clinical trials. Today, we're continuing on with the Cognoscopy. Dr. Bredesen's evaluation is screened for all the potential contributors and risk factors for cognitive decline. All of these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about the very important mineral, magnesium. Next up, we're getting into another critical mineral, zinc. Okay, so how does zinc relate to brain health? Zinc is an essential mineral that is necessary for almost 100 enzymatic chemical reactions. It is crucial in neural communication, helping neurons and nerve cells to send and receive messages. Zinc is necessary for proper brain development and function as it promotes neuroplasticity, that resiliency and adaptability of the brain we've talked about, as well as neurogenesis, the ability for our brains to grow new neurons. We absolutely need zinc for learning and memory formation, and having enough zinc on board makes us more resilient to the risk of cognitive decline and mental health disorders. It's been found that zinc supplementation after a traumatic brain injury accelerates the healing process and leads to better outcomes. Zinc is one of the most abundant metal ions in the brain and is found in high concentrations in the hippocampus, the chief memory center of the brain. Zinc is also essential for immune system function, protein and DNA synthesis, wound healing, senses of taste and smell, growth and development, especially during pregnancy, infancy, childhood, and adolescence, antioxidant function. Zinc is a powerful antioxidant that greatly helps protect cells from damage caused by free radicals. And insulin action. Zinc is critical for insulin synthesis, storage, and release. So important when we're talking about avoiding insulin resistance and having insulin sensitivity, which Dr. Bredesen has seen to be the single-handedly most important factor in us preventing or reversing cognitive decline. It has been estimated that as many as 2 billion people, more than a quarter of the world's population, are deficient in zinc. Zinc deficiency is especially prevalent in the elderly, with consequences that mirror Alzheimer's disease. Dr. Bredesen has seen most of his patients come up zinc deficient in initial lab work as part of their cognoscopy. Symptoms of zinc deficiency can present as digestive issues like diarrhea, abdominal cramping, nausea, and vomiting, roughened skin, hair loss, and discolored and distorted nails, loss of taste and smell, delayed growth and development, especially in infants and children, frequent colds and infections, slow wound healing, cognitive problems with thinking, reasoning, and poor memory, reproductive issues, especially in men as zinc deficiency reduces sperm count, pregnancy complications like premature birth and low birth weight, headaches, dizziness, lethargy, anemia, night blindness, vision loss, and macular degeneration. Zinc deficiency is no joke, but most neurologists don't really test for zinc. To support healthy cognition, Dr. Bredesen wants us to at least measure zinc in our serum. Optimal target is for zinc to be between 90 to 110 micrograms per deciliter. For an even more accurate reading, Dr. Bredesen prefers measuring zinc in red blood cells. For optimal cognition, Dr. Bredesen's target is RBC, red blood cell zinc, to be between 12 and 14 milligrams per liter. Another long-standing hallmark of dementia has been the association with copper status in relation to zinc. Most dementia patients have zinc deficiency and excess copper. Zinc and copper have an antagonistic relationship. That is to say, they compete with one another for absorption. If you have too much of one, it drives the other one lower. If you have too little zinc, copper starts to accumulate and dominate, which becomes inflammatory and toxic. It's important to keep these in balance. Copper is everywhere in our food supply, but we generally have much less zinc in our soils and crops than we did decades ago, due to current commercial farming standards. In light of this, Dr. Bredesen also wants to see our copper to zinc ratio between 0.8 to 1.2. To get our zinc levels into the optimal ranges, we first need to know how deficiency can happen in the first place. Common causes for zinc deficiency have been not getting enough in the diet, alcoholism, digestive dysfunction, type 2 diabetes, pregnancy and lactation. Zinc requirements rise during this time because the baby is using so much for its growth and development. Liver disease and kidney disease. Please check out episode 27 for Dr. Bredesen's recommendations on healing the gut and improving digestive function, and also check out episode 16 for Dr. Bredesen's anti-Alzheimer's diet to cover all our nutritional bases. The current recommended daily intake for zinc is about 11 milligrams per day for men and 8 milligrams per day for women. And the highest zinc concentrations can be found in foods like oysters, crab, lobster, mussels, shrimp, beef, pork, chickpeas, cashews, pumpkin seeds, lentils, and liver. Because digestive dysfunction has become so prevalent and the average nutritional value of our food supply has also diminished, if zinc blood levels are suboptimal, Dr. Bredesen recommends supplementing with a well-absorbed form of zinc called zinc picolinate. So to recap, Dr. Bredesen's optimal zinc blood lab range is serum zinc between 90 to 110 micrograms per deciliter, and RBC red blood cell zinc between 12 to 14 milligrams per liter. Additionally, Dr. Bredesen wants to see the copper to zinc ratio between 0.8 and 1.2. So, in Dr. George Brewer's 2013 study, 29 patients with mild to moderate Alzheimer's were supplemented with zinc and compared to 29 age-matched patients in a control group. Over 6 months, the group that were supplemented zinc slowed their decline significantly and in some cases improved their cognitive test scores. The control group with no zinc only declined. I've linked the study in the description below. Check it out. Dr. Bredesen prefers that we get most of our zinc intake from food, but definitely consult with your medical practitioner of supplementing and test levels often to see where you're at. And I'd love to hear from you. Has your neurologist ever spoken to you about zinc levels? What do you think of this video? Please drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve, and please like and subscribe as it helps our community grow. And remember, I'm not a doctor, I don't have a PhD, I'm a caregiver and citizen researcher on the ground helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful to you and your family, and see you in the next video. Thanks.